Okay.
Okay, hi. My name is Andrew. I am a psychiatry resident. I'm here with the lovely Dr. Deuter. I was a medical student back when I met her many, many moons ago. Thank you for having me, Dr. Deuter.
Yep. Yep. Thank you for being here.
Yeah, today, we're gonna touch on some pretty interesting topics. I was talking to you earlier, and you said that this podcast you haven't done it in about a year. Is that right?
That is right. Yep. The last recording I did was just about a year ago.
Wow. And I think today you mentioned that you wanted to talk about something pretty serious, which is revolves around your courage to shed light on your battle against breast cancer. Does that play a part of why you were gone the past year?
So about a year ago, a little over a year, I was diagnosed with breast cancer, and I stopped seeing patients. I took a break from seeing patients really abruptly without much notice.
Yeah.
And I took a break from all social media and stopped posting and stopped, engaging there at all. I needed to stop and focus on just what I had to do. It's kind of a full-time job having treatment for cancer.
Yeah.
You
Yeah.
have to go to chemo, and I had radiation. I lost all my hair. I had appointments sometimes every day. And so it's just really hard to maintain all these other roles while doing that.
Yeah, and I think it's important being a mental health professional, so many times I'm sure you advocate for people to take a step back and take care of themselves first before you
Yeah.
help other people. And you're actively doing that now, and that's what you did the past year. So before we go further into that, I want to hear from you, where are you at in your journey now, just so that we all know.
Yeah, so I mean, there's no known cancer in my body.
Okay,
So that's
good.
like remission, you
Yes, yes.
know. I did, like I said, I had chemo and radiation, and then now I'm on some medications. I'm on three different medications.
Okay.
And so, but that like they're okay. That's kind of settled down, and now like this is my plan for a while. These new cancer meds they do for years, and so they're
Okay.
2 years, 5 years, 10 years on the three meds.
So you're on the meds for 10 years then?
Mhm.
Wow. Is there a lot of burden taking that medication? Or is there not that many side effects?
Do you know what? So I started the first one, and I was like, oh, this is easy. This is cakewalk. This medicine people had told me like this is going to be hard. You might not feel well.
Hmm.
And I was like, no, this is easy. Started the second one, oh, like easy. And then I got to the third one and it was terrible.
It's
And
always
so
the
they've
last
had to,
one.
yeah, so there's been a lot of adjusting and trying to work out that third medicine, which has
Okay.
been terrible.
Are you
So
still in that adjustment period?
I am settled at a dose that is workable.
Okay.
Like this I can do.
Good. I was gonna say if you're feeling bad, I can't tell.
Yeah,
You
no,
look the
no, I
same.
don't feel bad now. I
Okay.
did. So I was on three times the amount of the hard to tolerate medicine, and
Oh
now
my
I'm
gosh.
on the lowest dose, and I think that's gonna
Wow.
work. So
That's so much.
yeah,
Now,
it's not good.
I imagine that you've had to go through a large amount of difficult treatment process. But
Yeah.
starting from the beginning, if you could take us back to that moment in that day, what was going through your head whenever you first heard the diagnosis of breast cancer?
So breast cancer is the most common cancer in women. But I'm going to tell you honestly, I had not, like, that was not on my bingo card for myself. I
Yeah.
did not think that that was what heart disease runs in my family. I figure like I need to worry about heart disease. I need to get cardiovascular exercise. I need to take care of myself and eat my vegetables, you know.
Hmm.
Like I don't have a strong family history.
Really?
And so it was like disbelief. I thought this is not correct.
Yeah. Is there anyone in your immediate family that has breast cancer?
No, no. So I just
Oh,
have like the spontaneous mutation,
like out of nowhere.
just bad luck.
Yeah.
Yeah. And that's what they told me. They were like, no, just bad luck.
Oh man. Well, starting from that day to where you are now,
Mm.
I'm sure it's easier said than done, getting your diagnosis to getting to the end of your treatment era. Um, what was that whole process like? What was your experience like going through treatment?
See, I don't know that I'm not the best case because I just did it. I think that there are some people who suffer a lot.
Mm.
I don't know that I felt like I suffered a lot. I
Okay.
knew that I could not hold it within the same space in my life, the need to take care of other people like you do as a physician,
Hmm.
and the need to stop and give that attention to myself and just take care of me. So I didn't try to do that. Um, but then within the space that I created and I knew what I needed to do, it was okay. And I went to treatment and it was okay. And I, was on like a vegan diet for a while because
Really?
that's good for cancer for like 6 months.
Really?
Just vegan, gluten-free, like almost completely, very, very little. And, and it made me feel good. And I walked for miles and miles every day and just
Wow.
tried to keep my life a manageable size, and then I did. And I felt supported. I have like, kind of have the best husband in the whole world. People like I say that a
That's what I've
lot, but
heard. Yeah.
he's really wonderful and he took good care of me and it's just the two of us because our youngest went to college. So we had all three of our kids off at college and just kind of us doing this together. He drove me to my appointments,
Mm,
cooked my dinner.
that's really sweet.
Yeah, but I mean, that's what you do. And so I felt like I was okay. Much of the time I felt like myself.
Hmm.
I'm not sure it's that way for other people. I think some people really do feel like they suffer a lot. And
Yeah.
I didn't feel like I did.
That's important to highlight that too, because I'm sure a lot of people who first get a breast cancer diagnosis imagine that it's always going to be the worst case scenario.
Yeah.
And so it's nice to know that someone who has been through it said, it's difficult, but it wasn't as bad as, um, the worst case scenario.
Right. And I think the other thing to say is I'm fortunate that I could take a step back from work and that was okay. There's some people who that puts them in the level of like economic crisis,
Absolutely.
right? They can't pay their mortgage or whatever. And like it was okay. I stepped away and like reduced and changed what I was doing.
Hmm.
And it was okay and manageable for me. So
Yeah. And I heard your husband was a good chef, a good cook.
he is a good cook. Yeah.
Hmm. I think,
And I'm gonna do a rude thing and look at my phone to make sure it's not an emergency. I apologize.
yes, go ahead.
And it is not. But I'm gonna answer my husband, who is picking me up today, wants to know what time.
Oh, his ears were ringing.
Well,
Now, I know that he makes good cookies. Were you able to eat those cookies on your vegan diet?
I didn't really eat a lot of cookies. We ate a lot of quinoa and a lot of beans.
Oh,
But
I love quinoa.
see, if you get into conversations with my daughter about the last year, she's gonna make fun of us for we joined an heirloom bean club.
What?
This is so nerdy. So we joined this club that ships you these like out of regular circulation beans. And we just made like vegan chili and
Well, what kind of beans are we talking about? Like
all
regular
kinds of
pinto
beans.
bean,
No,
black
no,
bean?
all kinds of beans, things you've never heard
Wow.
of. Listen, it was our little, our activity, these like
A bean connoisseur you have become.
so we ate a lot of beans and quinoa.
Do you still
Yeah.
eat that now? Are you still on the vegan diet now? Or have you
I'm
back up
not
yet?
now. No,
Okay.
I'm kind of back to normal, the diet now.
Yeah.
And it made me feel good physically, but food tastes good.
Food does taste very good.
Yeah,
Yeah.
yesterday we had pizza
From
and
where?
from Trilogy, which is
Oh, I don't think I had pizza there.
well, it might be the best pizza here. I'm just gonna say that.
That's debatable
It
against
was
Domino's.
telling you. Anyway, so yesterday we had pizza. Day
Well,
before
good.
that we had lasagna. These are things I don't always have, but all my kids are home with
Yeah.
me.
I'm
Yeah.
glad you've been able to step back into the older life that you had before cancer. I'm sure that's
Yeah. Yeah.
but I know that the whole journey is can be very intense. And a lot of times people say that it shifts their identity of who they are, who they see themselves as. Have you experienced anything like that, like a change in how you view yourself?
I mean, I think probably less than other people do.
Okay.
And that might just be something about the way I am.
Okay. Okay.
Uh,
Give us some secrets.
well, I don't see myself as like who I am is what I do for a job or how I look. I just don't
Hmm.
I don't experience life that way, but a lot of people do. So for a lot of people, like they've told me, a lot of women, particularly with breast cancer, have talked about how they were obsessed with the reconstruction of their breasts and like getting it
Yeah.
right, and it was never perfect. I've
Yeah.
heard that from a lot of women. And yeah, I don't feel that way. I feel like I'm still me and I don't feel like I'm not me. But I think um it's really, really hard if like a person's, part of the way that they relate to their self is wrapped up in things about the work they do, the way their body looks or feels. And I don't know, maybe I'm just odd, different, I don't know. But I felt like it was okay.
Yeah, I think that that's good to have that grounding perspective. And it's very impressive to see you practice that because you're a successful psychiatrist, you want to practice. I think there's a lot of avenues that you could get lost in, um, like whether your work or your appearance, and that you stayed strong, you know who you are. I think that helped carried you a lot out through your treatment.
Maybe, I mean, maybe those are things that I learned over the course of time and
Mm,
my practice and my growth as a human being, or I'm not really sure.
but
Um,
wisdom.
but
Mhm.
but but I know that it's okay. Like I'm as a physician, your birth date is available online with your licensing information. And so, I'm 51. And at 51, like you're already, your hair turns gray and then, like things change, you get older, you
Mhm.
have to have an ability to kind of adapt to the different stages of your life and a different
Mhm.
identity.
Mhm.
Like you're not always going to be 25.
That's true. And the
So
more wisdom you get, the grayer your hair gets.
apparently that seems
Hmm.
to be the deal.
Well, it seems like, during this time, this past year, your world started to crumble. But around that same time, you built a world in medical education.
That is true.
And you took on a role as program director for Tigmer Psychiatry Residency, which is amazing. Congratulations.
Thank you.
You know, did little Deuter ever think that she would be leading a medical residency?
So when I was a resident, when I was chief resident, my fourth year, I really thought that I wanted to be a program director.
Okay.
And then I decided though, my plan had been to join my department and, go through a path where I would eventually do something like that.
Mm,
But as I got through my chief resident year, I started to feel like I needed some other experiences.
mm,
That I would be like, it would be like staying at home in your same small town and
yeah.
you're just a kid there. It stunts your growth in some way. I don't know.
Yes. Wise
So
being age.
yeah, so I thought that I should go out and do something else and that I wanted to come back and do that later. And I always wanted to.
Okay. So this is like a dream in the making.
It was something that I thought I would do when I was at a later stage of my career, which I guess now I am. I mean, I've been in practice for 21 years, so I guess
21 years.
I'm at a later stage.
You definitely have all the wisdom to lead a program now.
Well, I guess so.
But your hair isn't all gray, which
No,
is
well, it's because
amazing.
I dye my hair, so it's this blonde
The
color.
secret. She's revealing the secrets.
It comes from a box. My color from a box.
Yes, and speaking of boxes, one of my new favorite metaphors is um, thinking about a program director, thinking of anyone in a leadership role. I like to see it as if you're stepping into a sandbox and you
Mm,
get to build your own castle.
okay.
So this residency is the sandbox, and you're the builder.
Mm-hmm.
What goals do you have planned for Tigmer's Sandcastle?
Mm. Well, so I would take one issue with what you said, which is like you step in the sandbox and you build the castle, but it's not my castle, it's the resident's castle. Like that is the role of a program director is to provide the residents with the education they
Mm.
need and deserve to become good psychiatrists,
Oh,
right?
yeah.
And so then I envision like we build a program that y'all could be proud of. You get all your needs met, things
Mhm.
run smoothly, you don't worry about what the program's doing, you don't worry if you're going to get what you need there. So I mean, as you know, part of what happened for this program is that the primary hospital where the residents train closed
Mhm.
a little over 2 years
Mhm.
ago. So the residents have been very concerned, like, am I getting good training? Am I getting what I need?
It's scary, yeah.
It's scary. By the time I came in, the program actually had the rotations that it needed. The previous program director did a really good job, and they're excellent rotations. There are wonderful things available for training psychiatrists in this city of San Antonio. Like it's wonderful. But we really needed to work on our like paperwork and like keeping order and the structure of things like meetings and keeping
Right.
meeting minutes and all this kind of stuff that's not very glamorous.
Sure.
But like we need to do that part too. So I've come in and kind of the next wave
Hmm.
and done that part.
Hmm.
And it's really rewarding. At the end of the day, you can see what you built. And I am building things in. I'm building like, okay, we need a committee that does this. It needs to have meeting minutes. We need these people on it. And we need a research committee. We need a resident to, chair the resident research committee and come in and bring in resources and help people do projects and things. And it is this building bit by bit, this
Hmm.
room by room, this structure.
Absolutely. You're the architect.
Yeah, it's pretty cool.
Yeah, yeah. And I appreciate what you said that, you're giving the residents I guess the lead on what needs to happen, and then you're helping make everything, fall into place. I think that
Yeah.
that's a really effective leader.
And that's what a program director is supposed to do. Like the residency is y'all's training, and I'm here to make sure you get what you need.
Yeah.
We're not here to do what I want. We're here to do what y'all need so that you can be good doctors.
That's so admirable. Something you've been wanting to do for since the end of your residency training, and it seems like you're approaching it very selflessly. Appreciate that.
I
Yeah.
hope so.
What's been your favorite part so far about being a program director?
Well, it's kind of funny because there's a lot that we're building and changing and but it's been a learning curve. I
Hmm.
really enjoyed coming in and learning a whole bunch of new stuff, working with new people, working with the residents. The residents overall tend to be fantastic people. A lot of people who show up and want to help and do different things and contribute amazing skill sets where I'm
Yeah.
like, I didn't know you could do that.
We're
That's
pretty
incredible.
amazing.
Yeah, y'all are pretty amazing. So like just like the learning curve. Just today, I made a QR code. I didn't know how to do that before.
Ooh, I don't know how to do that.
Right. So, there are things you learn every day, every day.
Oh, yeah, you're becoming tech savvy.
That in new ways, yes.
You better be careful. That gray hair is going to start going away. You're going to
See,
get
it's
younger.
gonna turn dark
It's
again.
gonna.
No, I don't think it is.
Well, they say, okay, so you're battling breast cancer and you took on a role as a program director.
Hmm.
They say leadership is about vision, and you seem to have your eyes on multiple horizons at once. How would you say your journey with breast cancer shaped or sharpened your vision as a leader?
Hmm. So, I had known for some time that I was going to have to step back from all the clinical work that I was providing directly to patients, that I can't run this clinic
Mm.
and be so busy hour after hour with patients that I can't answer questions, talk to the accountant on the phone, fill out paperwork, make sure things are done right. And it was really too much.
Yeah, it sounds like a lot.
And the breast cancer made me just abruptly stop doing other roles, doing the clinical role, so that I could just be the leader,
Mm.
which it turns out, if done well, being a leader is a bigger job than what I was doing before. And then being a leader for the residency and a leader for Sigma for this, clinic. Um, it's all similar work, if that makes
Really?
sense. So I can just stay in one frame. Like when you go and you see a patient, you have to switch frames. There's a different thing that you have to do. Um, Versus if you're gonna sit and, pour through your QuickBooks file and look at your finances. Your brain has to go from one kind of work to a different kind of work.
Absolutely.
And because the cancer made me stop the other kind of work, all I'm doing is the leadership frame. It's organizing and planning and having the vision for things, and I can stay in it. And then I'm more efficient.
Okay. Now, is that the role? Is this the kind of frame that you're gonna want to stay in moving forward? Are you wanting to adopt more of um, maybe a little bit in your extra time to take up patient care again?
No, I Unless it's an emergency and I'm filling in for other people, if people are overwhelmed and I'm here, and if they, have too much patient care that they can't cover, or somebody calls in sick or something like that. But no, I think the people who work here, the residents who rotate in the clinic, the staff members who work here, they need me to be the leader. They need me to be in that role. If a resident is rotating in my clinic, they need me to be readily available to answer their questions. So I
Mhm.
think I think it needed to move in that direction. And then now that that's in place, I don't think it would serve anybody, the individual patients included, for me to go back for a little while and then move out of it again.
I see.
Like, I think we need to accept that that was the next step and we're already there, so we don't need to go back. We need to go forward.
Yeah, it seems like the start of this breast cancer journey changed you in multiple ways.
Yeah,
Yeah, not just individually as a person, but how you practice your professional career moving forward.
yeah, yeah, it did.
Good. And just aside from professionalism as well, I would imagine this whole journey deepened your empathy and people going through grave situations. Do you think it's going to impact or already impacted how you communicate with like mentees or other residents?
Probably in ways that I don't even know how to quantify, right? That
That is wise.
because there are a lot of people, I mean, as you know, you look around you and you see other residents, there are people doing really tough work,
Hmm.
going through all kinds of things,
Mm.
and we don't even know what they are, right? Somebody, I
Yeah.
mean, I know there are residents in our program who have had cancer diagnoses.
Mm.
I know that there are people who have had divorce, miscarriage. There are people who've lost their parents, like really hard things, and they persevere and they continue to be of service to others. And so I think maybe um, it highlights for me how many things people go through, and they just persevere and continue to serve by being a physician.
Absolutely. And I think that's very inspirational to see someone leading us go through something so severe and come out on it and through it with a smile and continue to show up for the people that you care about. I think that says a lot.
I think people in our profession do that every day.
Oh,
I do. I think
that's
doctors
true.
show up and they're going through you don't know what, and they put that all aside and they stop and just give their attention to you. That's what doctors do.
Mm.
At least that's what the good ones do.
Yeah, holistic care, caring for the patient, mind, body, and soul.
Yep.
Yeah.
And so you stop, and if you're having a bad day or you had an argument with your spouse or whatever, you you set that aside and you meet that person's need. You stop and give them your full attention and think about their problem and how you can help.
It's very selfless in that way.
I mean, I think that's what the profession is.
Yeah. Well, Dr. Duder, I have one last question for you.
Okay.
I think, your story proves that purpose does not pause for chaos.
Okay.
What would you say to someone who feels like they have to wait until life calms down to step into their big goals?
Yeah, I've never thought that was true. I actually remember being a medical student and them saying, like, you're not going to have time to date, you're not going to have time to go out, you're not going to have time to have a life. And
Hmm.
I thought, like, it was during orientation for medical school. And I sat there and I probably kind of muttered under my breath, but this is my life too. And so you're
Hmm.
you're living life while you're studying, and you're making, for many people, some of the best friends you're going to have in your entire life, right?
Yeah.
When you're a medical student, when you're a resident. Um, so I don't agree that your life stops happening when you're stressed and busy. Your life continues happening, and then you have to embrace it and live. However you do that, like
Hmm.
you don't get to put life on pause.
Exactly. Exactly. And I think, now I'm also starting to believe that what is it? I'm learning, looking up acceptance commitment therapy. You feel sad, you
Mm,
feel down. You still gotta to do what future you would be proud of.
yeah,
And that's exactly what you did. You had your breast cancer diagnosis and you said, I had the opportunity to be a program director. I'm still gonna do it. And it seems like you conquered both. You're doing a wonderful job as a program director, and now you're in remission for cancer.
well, and they're not two separate things. I mean, improving my health and changing what I was doing with work are two very connected things. To not be switching my attention from this kind of work to that kind of work and neglecting part of it because I don't have enough bandwidth to switch back and forth
Mm,
like that. And my leadership responsibilities are growing as the organization I lead here is growing. I mean, me being healthier and not trying to do too many different kinds of things at once. Um, they go hand in hand,
I see. Intertwined.
intertwined.
I love it. Well, Dr. Duder, thank you so much for being open and vulnerable, sharing about what's been going on the past year. Um, Both, a success story and an amazing new opportunity as program director. I really appreciate your time.
And I would add that you're really good at this. Maybe you should
Thank
interview
you.
people. Coffee.
It's easy. Talking to you is so easy.
Well, it was great. You did a great job.
Thank you. Thank you.
All right.